So let's start with your PLAB journey, and what do you recommend to the beginners, or they have started, or they having. So let's start with the beginners first. So how they should start practicing.
So I think I'll start from the very beginning. Like for me, when I was in Pakistan, if anybody here doesn't know, I'm from Pakistan, Lahore. I did my MBBS. I was batch 2018 from Services Institute of Medical Sciences. And at that time, a lot of my colleagues, including me, were trying to do BHUs. But I was very clear from the beginning that I want to come to UK. And I have seen a lot of people, they're not sure if they want to stay back, they want to move to US, or they want to move to UK. But all the people who have joined us today here, I'm sure they are clear that they want to move to UK, and this because this is a PLAB-2 simulation. I'm sure they have already done their OETs and PLAB, and this is just the last step, hopefully, to get the GMC registered. So that is that. So the first thing is that you should be clear what you want. And the second thing is, a lot of people, when they come from their home countries, they're not sure about the training, what they want to do, or they are way too specific about the training. Like some people, they come here and they want to become a neurosurgeon, others want to become general surgeon, and some are like me, very laid back, who just want to become GP and don't want to, get into the hassle of getting into the training. So I think the first thing is that you have to be very clear what you want. And by clear mean that clear doesn't mean that you have to be very specific in your training. That clear also means you need to ask yourself, are you flexible regarding training? Like, can you choose from the given options, or you have certain specific criteria or a specific training in mind that you want to do?
Yes,
So
Sadia.
I think, that's the first part.
Yeah, I agree on that. I just questions for the beginners who just started
Yeah.
preparing PLAB-2. They have a lot of questions in their head. The one question is that is the job market is still saturated, and how they plan their journey, like how they start preparing for PLAB-2, and if they are coming to UK, how much time they need for their PLAB-2 preparation, and when they come to UK, what they should plan. They should plan clinical attachment, or how much time they do need to pass their exam. So as a like average doctor, how much time they need to practice coming to UK, like in academy, or how they should start preparing for their cases. How did you done that? So I just want to ask you, how did you practice? So that how would you recommend doctors to practice in as a beginner, or if they already started and they took their courses, how they can practice for the cases, and how what things they can book on before coming here, like ALS or a clinical attachment? What do you say about that?
So I think, Zeeshan, that's a very good question regarding the job market. Job market is competitive, and it has always been very competitive. But you all know that top is always empty. I know with the changing environment of NHS and with the inclusion of ACPs and ANPs, things are changing a bit, but nobody is certain what the future will be like. But it shouldn't demotivate you, because you are a doctor, you have a degree, and if you are doing PLAB, it takes almost 2 years for you to get GMC registered if you are coming with the PLAB exam. So I think the job market is very competitive, but don't let it demotivate you, and it shouldn't be a hurdle in your way if you want to come and work in UK and get trained from here, or if you want to come here only for for any other reasons. And the second thing, how much time for PLAB-2 is required? I think it depends from person to person. For like some people, they need a longer duration of time, like 3 months of time, and they will allocate like 4 or 5 or maybe 6 hours daily. And a lot of people who do PLAB, they already have jobs back home or here as well. So it also depends. So they have to customize their own PLAB-2 preparation time. And there are some people who cannot study for 3 months of time. Like for myself, I get bored and I get demotivated if I'm studying for that longer period of time. So there are some people who want to just get done with it, and they just need 1.5 months. I think that is the minimum time you need for the PLAB-2 preparation.
Exactly.
So 1.5 to 3 months.
Yes, 100% agree with that. Savera mentioned one very important point. Few doctors say that I will take 4 months, and I think that's the right way to do that. If you take 4 months and still you fail, you are, then what would happen? The point is that take like optimum time which is required. If you already in the UK, take 2 months and 1 month in academy practice, at least 1 month or
Yeah.
maybe weeks. You do need that, and this is how everybody do and does, and they pass with flying color. I assume, Savera, you also took like 1 month in academy, isn't it?
So my session, I think I was there was a different time. There was COVID time, and most of the sessions were online, like the one we are having. So I had like 2 to 3 weeks in academy, and but then yes, it became 1 month because then I had to go to academy for my mock sessions, and simulations. So yeah, you can say at least 1 month is the time you need from academy for yourself, other than the self learning.
Okay. And would you recommend clinical attachment, the doctors who are already coming here, how they can find out clinical attachments or ALS at the moment
Um,
for job?
Zishan, that is a very tricky question for me to answer because when I came here, I didn't do any clinical attachment, but things were a bit different at that time. And my first job was also locum. A lot of people doesn't feel comfortable doing their first job, the locum job. So again, it depends upon you. If you are happy to do the locums, like if you are sponsored by somebody, you are already in the UK, if you have visa, go for locum jobs, and then you can get entry into NHS, isn't it? It's
Yes.
like you as well. You did your first job as locum as
Yes,
well.
yes. This is what
Yeah,
I believe.
yeah.
Lot of
And then
people
there,
don't know. Yeah.
yeah, and then there are other people who are not, they're not sure about the locum and they want to observe the things in NHS first and then enter into it. Then I think they should do clinical attachments,
Yes, yes.
isn't it?
It's a funny thing, but definitely, if you are you got the NHS job, you get the visa from the hospital. Either get sponsorship from the hospital or from your spouse, husband.
Yeah,
Get
yeah,
married.
that's true.
Get married. That's the
Get
best way to
married,
start.
guys.
Get you will get the visa, and after that you start doing the locum. So I highly recommend start doing locum after your GMC. I started myself F1. Savera also started locum. That will definitely, if you work in the same hospital where your spouse is working, or in any case, if even you got a post study visa as well, there are different way start as a locum. But I do recommend clinical attachment now. So you should book clinical attachment. You can find through the LinkedIn. You can ask anyone. So how I did get my first clinical attachment in 2019, I just see a blogger on the Instagram. So I just chased the blogger and told him that I want to do that. He spoke to the consultant. This is how you build networking. So if you build networking, maybe Svera can help, maybe Dr. Kazmi can help, maybe Dr. Ramesh has a lot of list of things. Book that. You plan your journey.